I'm Sean Alcock, Head of Health and Social Care Systems for Midlands Partnership University Foundation Trust. First of all, it provides uh, access to people that can't get to maybe see clinicians or to a location. So equitable access is a big thing that we aim to achieve with that. But I think we were hoping, for efficiencies, whether that's saving from travel, whether that's reduced reduced expenses, or if that's you can see more people in a day because there's less travel. And those are all the things that we were hoping for from the product, really. Yeah, I mean it's interesting, really, because with video consultations and our approach to it and how we needed to communicate to patients that there is a video consultation and they need to click a link and they need to turn up. We had a bit of a challenge that said, well, how do we communicate? And we chose to do that via SMS predominantly. We did it via letters as well, but the biggest impact is SMS. But we soon realised that we hadn't really got consent to communicate around video consultations with the numbers that we'd got. So we had to work with IG people, information governance within MPFT, figure that out, store that specifically, get consent, and then start to use SMS to communicate that out and invite people to video consultations. Yeah, so largely it's been positive. I think we've got some stats, and I think one stat that stands out is 60 to 70 people have said that it is easy to use, it's convenient, and that it's saving time. So I think we have lots of positive feedback. Yeah, it's crucial, really. I mean, we did historically have separate systems, and that was even trickier to communicate with, because we wouldn't have access to patient records in one place, we wouldn't have numbers, and we wouldn't have the ability to do that. But for the integrated solution that we've now got, for our clinicians, they can click straight through from the calendar, get to the video consultation. For our patients, because of the way we built the SMS system, they get the SMS, get a reminder, click the link. Everything is so easy and so seamless because it's fully integrated. Yeah, it's been great. I mean, that particular project was straightforward. It was sort of a switch on, bit of testing, bit of governance. I think a lot of the problems were outside of the technology and more about how do we get this to patients and how do we train staff to make sure that they've got the number, make sure that their contact details as a clinician are stored and up to date. So some of those things that are outside of the technology needed to be there, but now that people are underway with this, it's proven to be beneficial.